Hello everyone, I am Dr. Khushi, second year radiology resident from DY Patil Medical College, Hospital and Research Center, Pune. I am going to present my paper on the topic Deep Vein Thrombosis of the Lower Limbs, a retrospective analysis of Doppler ultrasound findings. I am going to present this under the guidance of my guide, Dr. Purnachand Lamgare sir, Professor from Dr. D.Y. Patil Medical College, Pune. Deep vein thrombosis is a major cause of morbidity and mortality, primarily due to pulmonary embolism. Most thrombi are clinically silent, requiring imaging for early detection. Duplex Doppler ultrasound is non-invasive, rapid, and first line for suspected DVT cases, and Indian epidemiological data remain limited, especially outside orthopedics. Objectives. The primary objectives are to evaluate Doppler USG as a diagnostic modality in DVT, assess spectrum of Doppler findings in lower limb DVT cases, analyze anatomical distribution, stage, and extent of the thrombus. The materials and methods used. The design is of retrospective descriptive analysis. Duration from September 2011 to September 2013 was used. A sample size of 78 patients diagnosed with DVT on Doppler were used. Equipment was Sonosite Micromax Siemens Accuzone. The evaluation of common femoral vein, superficial femoral vein, popliteal vein, calf veins, and iliac veins were done. The criteria which was kept was of compressibility, visualized thrombus, flow pattern, and augmentation. The exclusions were of the pediatric age group and the cases of neoplasm. Coming to the demographics, age range of 21 to 83 years was used, peak group of 51 to 60 years. Sex distribution was 58 cases of male, 20 cases of female, who came with the presenting complaints of edema in most of the cases, that is 61%, pain plus edema in 17% of cases, past history of DVT in 11%, pain in 8%, and pulmonary embolism in 3%. Coming to the predisposing factors and anatomic distribution of thrombi. Predisposing factors included prolonged hospitalization in 32.1% of cases, post-operative in 10%, trauma related in 6.4%, long-term OCP use in only 3.8% cases, and no identified risk factor was seen in 47.5% of cases, with unilateral thrombosis in maximum of 96% and left lower limb predominance in 82.7% of cases. Prolonged immobilization was the major modifiable risk factor. Nearly half had no identifiable risk factor, showing silent disease behavior. DVT was mostly unilateral with strong left-sided predominance, which regarded to as May-Thurner's pattern. Coming to the veins involved, maximum cases of superficial femoral vein were seen, that is 88.5%. Common femoral vein was next, 73%, followed by popliteal vein in 69%, posterior tibial in 62%, and anterior tibial vein in 32%. Iliac veins were limited to 14 to 23%, and superficial venous system showed a contiguous extension in 8.9% of the cases. Femoral and popliteal veins were most commonly involved, that is proximal DVT pattern. Tibial vein involvement reflected towards the distal to proximal thrombus progression. Iliac and superficial venous extension indicated advanced propagation, and above knee dominance suggested higher risk for pulmonary embolism. Coming to the Doppler findings, subacute thrombi were most common, suggesting delayed presentation. Complete occlusion predominated, indicating significant venous blockage. Multiple contiguous segments in 91% cases suggested thrombi extending along connected veins, and no non-contiguous thrombi reflecting continuous progressive propagation. Stage of thrombus included subacute, acute, and chronic. Subacute with maximum percentage, then extent of maximum having complete thrombosis rather than partial, and with pattern of multiple contiguous in 91% cases. These are the representative images showing color and B mode Doppler images showing absent flow, increased vein caliber, and thrombus characteristics. Coming towards the end of the paper with discussion and conclusion, duplex Doppler USG offers high sensitivity, which is rapid and completely non-invasive. The study showed a predominantly subacute above knee and contiguous thrombus pattern indicating progressive propagation. Left-sided predominance reflected known anatomical predisposition, that is iliac vein compression. Complete thrombosis was common, emphasizing the importance of early imaging before occlusion progresses, and routine Doppler in symptomatic or high-risk patients supports timely anticoagulation and reduces PE-related morbidity. In conclusion, duplex Doppler USG is an essential first-line tool for early detection and comprehensive assessment of DVT, enabling prompt intervention and prevention of serious complications. These were my references which I used. Thank you so much.